Hello and welcome to the Primetimers. I'm your host, Marty Moore. We're at St. Mary Mercy Hospital on 5 Mile Road, and we're here at a fair, a very unusual affair. It's about not panicking. It's about being prepared for emergencies. It's just hoping to give you the information you need to talk to your parent or to your child about what you want done for you in case you can't speak for yourself. As you'll see, there's a lot of things happening right here in your own backyard. Michelle is here, and she is the lady who put all this together, and we're ready to ask questions and not panic, right?
Exactly. You got it.
When you decided to put all this together, how did you manage to get this many people to cooperate?
I think it's incredible. We work with a lot of group of people that have servant leadership capabilities. We run a group here called Star Forum, Safe Transition of All Residents for You and Me. And we get together and we talk about how can we better the community, how can we improve transitions of care. So I reached out to them and said, National Healthcare Decisions Day is coming again. What can we do about that? And then Stacy Barissima, who is our senior ER social worker, she had attended a Washtenaw meeting with Red Cross, and they had did something around emergency preparedness. So we said, why don't we combine both events together, because we've been doing National Healthcare Decision Day every single year, and put on this program for the community. So I didn't do it all myself. This would have never came together with all the community partners that pitched in, donated things, items for the disaster kit. And it was all around emergency preparedness, but also is recognizing that we also have to prepare for the end of our life, and we also have to have that discussion just in case something happens that we can't speak for ourselves, that we have actually asked someone to speak for us.
One of the things working in an emergency center is we would rather have you have the talk before you come into the ER, to actually have it at your home, have it during dinner, have it during Easter with your family, to have these conversations. Because unfortunately, sometimes what can happen, and many of you probably have had that experience, where something tragically has happened, and we don't know what somebody's wishes are. So we want to be proactive instead of reactive, and it's actually a gift that you give your family, and Julie will be talking to you about that too. Well, today for National Healthcare Decision Day, as you also can see, that we're also doing emergency preparedness.
Tell us, if you will, your involvement in this wonderful program.
Sure, absolutely. We were contacted by St. Mary's Hospital. We work closely. The interoperability and working with our local partners, being part of the city is very, very important. So St. Mary's reached out to us and said, hey, we want to do this fair together for emergency preparedness for National Healthcare Day that's going to be coming up. So I have a lot of information I can put out in conjunction with what information they can put out, and I thought it was just a great opportunity. So we started working together and starting through the planning phase. St. Mary's been great, with great to work with and great as far as putting this all together.
Well, I think it was just amazing, that you were talking about things 20 years ago you would have never brought up.
Correct.
But these are things we need to know as parents, as grandparents, our grandchildren, when there is an emergency. They also have to know, like it was mentioned earlier, what if you can't tell them what you want done, type of thing. So that's a lot of stuff under emergencies.
Correct.
But these are the little things that get lost, and people panic, and then they react even worse.
Exactly, and that's what we had suggested to do one thing, and there's a bunch of different programs, a way of breaking it down. We don't want to reinvent the wheel. We want to take what is already out there, maybe mold it to what we need for our personal lives, our personal circumstances, and then we can combine that into like the bigger scheme of things. So I said, for the city standpoint, being the Director of Emergency Management and Homeland Security, is the more we can get people to be prepared on their our own and think about things, just the easier it makes it for the city should something large happen, or even something small for that matter. You know, the house fire or just a medical emergency that may happen at somebody's home. You know, it's getting back to that village mentality where we all work together as a village as opposed to being individuals, and know who our neighbors are, and putting down the cell phones, and you know, like we had mentioned, it's getting back to the brass tacks, I guess, so to speak, and you know.
I want to thank you for
Thank you
joining
very much.
Livonia Television and putting on a wonderful presentation. It took a lot of people doing a
Well,
lot of work.
I appreciate it, and you know, at any time, you know, Livonia, even people outside the city, that's what my job. That's what I'm here for, is to help people out. So you know, whatever we can do to help people along, answer questions, that's what we're here for. And thank you very much for your time.
Thank you.
Thank you.
So when I say to you 96 hours, what do you think? Someone throw it out. How long? 3 days? Well, 96? 4 days. 4 days. So, but 4 days of what? 4 days to be prepared. FEMA, a lot of other documentation will say at minimum 72 hours, minimum 3. I like to round up and say that it can take upwards of 4 days. So here at St. Mary Mercy Livonia, as well as other hospitals within the health system, within Trinity Health, we perform this 96-hour survey. And we want to know, how long is our water good for? How long is our fuel sources good for? Our oxygen? All of these other things that come down to our operations to ensure that we can provide the same standard of care to all of our residents as they're accustomed to. But we need help. We need help to make sure that you are as prepared as you can be, just as Brian spoke of. And so one of those ways, when we stop to think about it, we sit back and we say, man, 96 hours, that is so incredibly daunting. How am I going to keep myself and my family and my dog and my cat and my bird and my pet fish and everyone else prepared for 96 hours? Well, there is one way of doing it, and that's called do one thing. Just do one thing. For yourself, for your family, and for your community. There is a calendar out in the overflow for you to pick up and take with you. But the whole principle is that we don't have to do everything all at once. Do one thing a month. Each month is laid out in this calendar. It has a goal, it has a theme, it has something for you as an individual or as a family to focus on. What is that one thing? Do that one thing. That's your goal for that month. With the exception of February, you have 30 to 31 days to do that one thing. It might be go to the grocery store and buy some water. You have a month to do it. Make sure that I have a can opener to go with the canned goods. You have a month to do it.
I'm with Colin Hadley, who had a big, the audience loved you, to tell us your involvement and, you know, what was your thing about working with this group?
So here at St. Mary Mercy Livonia, I am the emergency management coordinator for the hospital. So I look at disaster preparedness for this organization. So I am able to take some of the principles, such as I talked heavily on the 96-hour survey, and things that we do as an organization will translate very well to the individual also. Mm-hmm. So taking this idea of the 96-hour survey, bringing that in, looking at just not being overwhelmed of, you know, worrying about not being able to see the forest for the trees. So that do one thing are really some of those striving points and some things that I was able to bring into this program of the, you know, National Healthcare Decision Day. And this is just something that is so important to not only the individual to be able to make sure that they are prepared for them, but when each and every person is prepared as an individual or as a family, it really helps our our first responders and the needs that they may have to give, and even for ourselves as a healthcare organization, some of the needs that we may have to give to support. When other people are prepared, it allows us to help more people because there's that lessened demand.
My concern as a senior citizen is talking to the people. I thought you brought up some very good points with this 96 hours, making yourself aware this is not just going to be a 1-minute thing.
Right.
And getting your kids or your neighbor or whoever your responder is going to be the person helping you. I thought you did a very nice job.
Thank you.
Thank you for your time.
I mean, that's something when we consider our neighbors, and especially for our growing senior citizen population, where some may be widowed, but maybe they've lived on the same street for the last 30, 40 years, and you know your neighbors. And, so we look at this do one thing, or being prepared for 96 hours, and we look at food rations, and we look at water rations, and we look at all of these things. Sometimes it can be very scary to think that I'm going to face this alone. Team up with a neighbor and split those responsibilities, and then we say, hey, an emergency happens, we'll take my house, we'll take your house, whatever it may be, and then we're going to be here to support each other.
Need to be talked about.
Yes, and this way you're there to support each other. Thank you.
We're at a presentation here for home safety. We have our 10-year smoke detectors, our 10-year CO detectors, and our Knox home box locks for senior citizens. We install these on the home. We have a key in each rig. We can get into the house without causing any damage. Inside that box will also be information for the family and for the person's maybe medical information.
Great.
This is a temporary box we can hang on a door for up to 90 days. With more, this is about $150.
Wow.
This is free to the citizens of Livonia.
Oh my.
We also have a smoke detector program. We're installing smoke detectors in the homes and one CO detector to go with it.
So if you have a senior that needs to have a installation of a smoke detector, they would contact you.
That was called, just contact the fire department, fire headquarters.
Fire headquarters will do that. Thank you.
All right, thanks.
I'm Pandora Ashley with FIRSTLIGHT Home Care. I own a non-medical home care company here in the city of Livonia. I retired 2 years ago from the city. I was a 911 dispatcher, and my purpose today is to help promote 911 for the city of Livonia. As you see here, what we have is these they're emergency contact forms that you can find on the livonia.gov website. When you go into the Livonia Fire Department website, you can pull up this emergency contact form. The importance of this form is to let the police and fire department know what, if you have an emergency contact person, any of your medical conditions, but it also is important because what they have down here is a place where you can fill out your garage code number, hidden key location, or the lockbox number, so that they are able to get into your home if you have any type of a medical emergency, a fire emergency, or some type of a police situation, so that they're not breaking down your doors and windows.
Audra Stoker is here, and she's helping us not panic. Is that correct?
That's right. My name's Audra, and I'm with Oakmont Senior Communities, and I'm here today for our emergency preparedness event. We're providing sewing kits, and we are here helping people get prepared.
Here at St. Mary's Hospital, it's hard to believe that there are these many people involved in being prepared for an emergency. And with more and more people coming together, these are things we have to talk about and share. Here's another guy, medical care alert, and you are the owner, and you are?
I'm Brian Stapp. I'm the president and owner of Medical Care Alert. We're based out of Northville, and we provide emergency response systems for seniors or anybody that needs some help. So they would just wear a very small button like this, and if they press the button and they need help, we'll ask them what their situation is, and then our emergency response center will call either a family member or a friend or emergency services if needed. And there's no long-term contracts that cost about $1 a day, and we save lives every day.
That's marvelous. I didn't know it was that easy.
It is that easy.
Harry is from the Fredwood Funeral Parlor, and has some very special starter kits just to help you on your way to talking about those things you need to talk about.
Absolutely. Spark the conversation about putting a plan in place for yourself and your family. It's the greatest gift you can give.
I'm prepared and I'm being remarkable. We had a wonderful time here at St. Mary Mercy Hospital, along with the folks from City of Livonia and many, many people who participated in planning for your future and things that might go wrong. If you know about it, you can handle it a lot better. I'm happy I was here. I'm glad you joined me. I'm Marty Moore, and you've been watching the Primetimers.